Hi everyone, welcome back to your favorite channel where medical topics are made easy. I'm your host. Today we're going to discuss the truth about atorvastatin side effects. Specifically, we're going to talk about 3 big concerns that people have about atorvastatin muscle aches, diabetes, and memory loss. We'll also talk about what you should know before you start taking this medication. If you don't know this already, atorvastatin is a medication that is used to lower your cholesterol, specifically high blood cholesterol. Atorvastatin falls into a class of medications called and before we move forward, it would be helpful for you to know that this video is not intended to provide any medical advice. The information provided in this video is meant to be informational and educational purposes only. Okay, let's get started. So the first thing that we need to establish is what is atorvastatin and how does it work, okay? So atorvastatin is a prescription medication that is sold under the brand name Atorvastatin is a type of medication called a statin, which is used to lower cholesterol. As I mentioned earlier, atorvastatin is part of a group of drugs called and the way that atorvastatin works is by blocking an enzyme in the liver that makes cholesterol. By blocking this enzyme, your liver will make less cholesterol, which, in turn, lowers the amount of cholesterol in your blood. Lowering the amount of cholesterol in your blood can help to prevent heart disease and stroke. This is because high levels of cholesterol in your blood can lead to the buildup of plaque in your arteries. Plaque is a deposit that can narrow your arteries, making it harder for blood to flow through them. When this happens, it increases your risk of developing heart disease or having a stroke. So now that we know what atorvastatin is and how it works, let's take a look at some of the common side effects of atorvastatin. Like all medications, atorvastatin can cause side effects. However, not everyone will experience these side effects. Some of the most common side effects of atorvastatin include headaches, muscle pain, fatigue, nausea, constipation, diarrhea, abdominal pain, flatulence, dizziness, insomnia, depression, anxiety, memory problems, weight changes, elevated blood sugar levels, and increased creatine levels. If you experience any of these symptoms while taking atorvastatin, it is important to speak with your healthcare provider. They may be able to adjust your dose or switch you to a different medication. So one of the most common concerns that people have about atorvastatin is whether or not it can cause muscle aches. If you've been researching atorvastatin online, then you probably have seen many people claim that atorvastatin causes muscle pain and muscle damage. This concern has led to the development of the term statin muscle. In fact, there is an association between statin use and muscle symptoms. Statins have been linked to the development of myopathy. Myopathy is a fancy word for muscle disease. However, it is important to note that the risk of developing myopathy is small when taking atorvastatin. Studies have found that the risk of developing myopathy from atorvastatin is between 0.1 and 0.3%. Despite the low risk, if you are concerned about developing myopathy, you should speak with your healthcare provider. They will be able to help you weigh the risks and benefits of taking atorvastatin. If you decide to take atorvastatin, they can also monitor you for signs and symptoms of myopathy. The next thing that I want to discuss is diabetes. One of the concerns that people have about atorvastatin is that it can increase their risk of developing diabetes. This concern is valid since several studies have shown that atorvastatin can increase blood sugar levels, which can lead to the development of diabetes. However, it is important to note that the risk of developing diabetes from atorvastatin is small. Also, the risk may vary depending on the dose of atorvastatin that you take. In general, the higher the dose, the greater the risk. That being said, the risk is still relatively small, especially when compared to the risks of high blood cholesterol. If you are concerned about the risk of developing diabetes from atorvastatin, you should definitely speak with your healthcare provider. They can help you decide if the benefits of taking atorvastatin outweigh the risks. Another concern that people have about atorvastatin is memory loss. People wonder if atorvastatin can cause memory loss or cognitive decline. Several studies have investigated the relationship between atorvastatin use and memory loss, but the results have been inconsistent. Some studies have found a link between atorvastatin use and memory loss, while other studies have found no link. So what does this mean for you? Well, if you are concerned about memory loss and atorvastatin, you should definitely speak with your healthcare provider. They can help you weigh the risks and benefits of taking atorvastatin. They may also be able to recommend other medications that may be better for you if you are concerned about the safety of atorvastatin. Now let's talk about what you should know before you start taking atorvastatin. Before you start taking atorvastatin, it is important to know that atorvastatin can interact with other medications that you may be taking. This can cause side effects or reduce the effectiveness of atorvastatin. Be sure to tell your healthcare provider about all of the medications that you are taking, including over-the-counter medications and supplements. Also, you want to be sure to follow your healthcare provider's instructions for the correct dose and frequency of atorvastatin. Atorvastatin is available in several strengths, including 10 milligrams, 20 milligrams, 40 milligrams, and 80 milligrams tablets. It is important to note that you should never crush or chew atorvastatin tablets. Instead, you should swallow the tablets whole with a glass of water. Doing this will help to prevent the release of too much atorvastatin at one time. Also, you should know that atorvastatin should be taken at any time of the day. However, it is best to take it at the same time each day. This will help you to remember to take it. Finally, you should know that it takes about 4 to 6 weeks for atorvastatin to lower your cholesterol. In addition, you should continue to take atorvastatin even if you feel well. Do not stop taking atorvastatin without first talking to your healthcare provider. Let's take a look at who should avoid atorvastatin. You should not take atorvastatin if you are pregnant or breastfeeding, if you have active liver disease, or if you have a history of severe allergic reactions to atorvastatin or any other medications. Let's move on to our last topic, which is what you should do after you start taking atorvastatin. After you start taking atorvastatin, you should continue to take it as directed by your healthcare provider. It is important to note that you should monitor your liver function and cholesterol levels for the first 12 months that you take atorvastatin. Your healthcare provider will be able to determine how often you need to have your liver function and cholesterol levels monitored. In addition, you should contact your healthcare provider right away if you develop any new or worsening symptoms while taking atorvastatin. And there you have it. Hopefully this video answered your questions about atorvastatin. Remember, it is important to talk to your healthcare provider. If you have any questions or concerns about atorvastatin or any other medications that you are taking, don't forget to like and subscribe. Until next time, stay healthy, stay happy, and stay informed.